my name's Melissa, and I'll be with you for the duration of this program. Today we're going to be discussing how to work with your healthcare provider on becoming independent with taking your prescription medications. Self-administration techniques allow you to become in control of your own health and safety. These techniques allow for your healthcare professional to assess your understanding of the medication, how you take your medication, and your general knowledge about medications. Throughout the video, you will see various uses of tools. There are various types of tools, such as the Muse tool or the SAM tools, but there are various other kinds that your healthcare provider may use that may not be included in this video. First, we will explore a scenario that you may encounter with your healthcare provider.
Hey. Hi. So I'm Gwyneth. I'm the community nurse doing this checkup visit. Here's the prescription. This is yours. Do you have any questions?
Nope.
Okay. Yeah. So that's it. If you have any questions, call your doctor. Have a nice life. Okay.
Okay. See ya.
Dang, I don't actually know how many to take. Guess I'll take 2 based on my size, and that's the normal dose. No harm done, right?
Wrong. Taking the wrong dose of medications can be harmful and have detrimental effects. It's important that if you're in a situation like this that you ask your healthcare provider questions. The second scenario involves a nurse who uses the tools mentioned previously.
Henry, get the door!
Okay, fine. Come on in.
Hello.
It's in the kitchen.
Okay,
Here.
thanks. Jay?
Yeah, I'm Jay.
Hi. I'm Marianne. I'm just the community nurse here. I got your prescription bottles from your doctor.
Thanks.
Hand that to you. So first we're going to start off with a couple questions. It's just a list of things we're going to go through to make sure you know how to take your medication, okay? Okay, so there's medication. Do you know what it's for?
Yeah, I talked about it with my doctor.
Okay, and if you don't mind, in your own words, can you just explain it to me?
It helps me pee.
Yes, basically, yeah. And do you understand the plan with you and your doctor, the one that you developed, that you should finish it? Okay, good. Because it's important to know that if you don't, it might not work properly. But if you do, it's very beneficial to your health.
Okay.
Awesome. So let's begin with the question. How many tablets should you take?
2?
Why do you say that?
Based on my size. Sounds about right.
Okay, I understand where that's coming from. But actually, if you take a look, just under your name here, it says 1.
Oh, I didn't even see that.
Yeah.
It says take 1 tablet every night at bedtime.
Exactly. Good. We're still learning. But just remember, take your time when you read these kind of medications, okay? How do you think you should take the tablet?
This is orally.
Yeah. But do you know what that means?
Through the mouth?
Yes. So you swallow it. Don't chew it or leave it to mouth. Okay?
Okay.
Okay. So with the medication, can you find or do you know the side effects of it?
Maybe I'll get sleepy?
Not quite. If you can't find it on the bottle, there's this thing here, a website, and a couple other resources you can use to find your side effects.
Oh, WebMD! I've used that before.
Yeah, so you can even pull it up on your phone and everything. You can even try it now.
Okay. Cool.
Do you see the side effects at all?
Wow, look at them all. There's tons!
So what did you think?
It was good,
Mm-hmm.
but it said adverse effects. Is that the same thing as side effects?
Yes, it's kind of like the same meaning, but different words. Yeah.
Okay, and there was a lot of them.
Yeah, I saw that too. But don't worry, they're minor, so if you get a little nauseous, pop a Grapple, you're okay. But not everyone has them, so you don't have to worry. Okay?
What if I do have them?
If you do have them and you don't know what to do, I can give you a reference sheet for your doctor's number, a pharmacist, or even myself, and then you can ask us questions, okay?
Okay.
Did that help at all?
Yeah, that was
Awesome.
good.
I'm glad. So I'll leave you to it. I think we're good for now. You've marked everything on my tool list here.
Okay.
Yeah, so you understand everything. If you have any more questions, you can definitely call me up. Otherwise, you're set to go. And I'll leave this with you too, okay? In case you have any more questions or forget anything.
Awesome, thanks.
Yes.
As you saw in the second example, the nurse was able to adapt her techniques to individualize for her patient.
After these two situations, we can see that as a nurse, it's very important to establish the needs of your patient, and as a patient, it's important to ask questions and seek help. Your safety is very important.